That we have this morning is Dr. Sevtap SAVAS. She holds a PhD here in Newfoundland and Labrador, and she's going to be talking to us today about why this conference. This session is going to be recorded, so just keep in mind and mindful when you are putting your thoughts in the chat and the privacy while engaging. Whenever you're ready, Sevtap.
Thank you so much, Jan. Hey, folks, it's a pleasure to be here today. Absolutely. And today we are going to talk about why we organize this conference and who organized this conference and what we aim to accomplish by this conference. So first thing first, I would like to acknowledge the lands on which Memorial University's campuses are situated are in the traditional territories of diverse indigenous groups. And I acknowledge with respect the diverse histories and cultures of the Beothuk, Mi'kmaq, Innu, and Inuit of this wonderful province. I wear a lot of different hats, folks. I have roles within and outside of my primary institution, which is Memorial University of Newfoundland and Labrador. The key roles and institutions I volunteer are shown here. And I just want to say that today my thoughts do not represent any of these organizations. I rather represent myself today. I want to start my presentation by sharing a little bit of my family's history with cancer. So this person you see on the left side is my sister, Sevtap SAVAS. She's a long-term survivor of high mortality cancer. And she's well today, but of course, you know, there are long-term effects of cancer, but she's dealing with them, and she's dealing with them very successfully. And I'm very grateful that she is surviving and with us today. This person on the right side is my mom, Nimet Altunbaş. My mom was the only caregiver of my sister during her treatment, post-diagnosis, and so on. And only recently, I realized that I never asked my mom how she was doing, whether she needed any support, any hand, any help. So, folks, oftentimes we don't pay attention to the caregivers, but they are so crucial in our cancer journey. So this is a good opportunity right now to acknowledge all the caregivers in this conference or outside of the conference. If you see one, next time, please ask them how they are doing and give them a hug. So this is our last picture with my mom, because she died of cancer, unfortunately, 3.5 years ago. Now, by sharing my sister's and my mom's history with cancer, I'm hoping that we all realize that we are together in this. We are together in this. I see you, I hear you, you saw me and heard me right now. And I think together we can really do things better. Folks, this is the idea. We need to have better days ahead for the next patient, next family. And we can do that if we come together. So today, as I said at the beginning, I'm going to talk to you about why we organize this conference, who organized this conference, and what we aim to accomplish, and how we can maybe to go towards better days ahead altogether. Starting with who organized this conference. This conference has been organized by the Patient Advisor Committee of the Atlantic Cancer Consortium. This Patient Advisor Committee includes me, and 3 other academic staff, as well as currently 11 public members from Nova Scotia, New Brunswick, Newfoundland and Labrador FPEI, who are affected by cancer. So they are our patient advisors. We call ourselves ACCPAC. And we are, again, a part of Atlantic Cancer Consortium, which is a part of the Marathon of Hope Cancer Centers Network, which is a national initiative by the Fairfax Foundation. We are very grateful for this initiative. I'm very excited to be a part of this national network. Now, we, the Patient Advisor Committee who organized this conference, actually we are very young. We started to form less than 1.5 years ago. We aim for a diverse and inclusive committee members from all Atlantic Canadian provinces. And in January 2024, we started to meet virtually, and we still continue to do so. And so far, we have worked on two different main goals. First was to identify the priorities of patients and families in the region. And the second one was public engagements, such as this conference, in terms of precision medicine, cancer, and patient and family voices. So what are these priorities which kind of actually informed this conference as well? The priorities that our patient advisor committee talked about. I mean, some of these are also mentioned in the previous patient panel. But let's go through this because, as I said, these priorities identified by the committee actually informed the topics that we are going to talk about today in the conference. The most important needs or priority is addressing the information needs of cancer patients and families at the time of diagnosis, during treatment, or post treatment. So people, for example, would like to know about their cancer type, their treatment options, their clinical trial options, support options, how to navigate the system, and so on. So, and they want it in the right time and in the right way. As Kara also said in the previous session, there may be a booklet, there may be a website, but they may not be really very useful to the patient. Or Jill also mentioned that, you know, his friend received information, but it wasn't understandable. So we really need to make it understandable on the right time, in the right format. So that's really important, especially considering that we have a lot of misinformation going on as well. So the second priority this committee identified was something related to the information needs, which is addressing the support needs. Now, we have seen also during our previous session where we talk about, you know, cancer, precision medicine needs and priorities. Patients and families may have various support needs because cancer is such an impactful disease. What could they be? There could be financial support needs, emotional, physical, psychological, and so on. So our patient partners in this group's committee suggested that it would be really good to inform the population about the support programs available in the region. So we are going to talk about that, for example, patient navigators, psychosocial oncology, and so on. Advocacy came as an important part of the priorities and needs as well. Self-advocacy in the clinic to receive the best care possible, and outside of the clinic to make things better. For example, advocacy through the government. It looks like it's an important activity. Many of us are advocates, and you will see through the end of this conference that advocacy, both self-advocacy and advocacy at the government levels work. So if we can get together, folks, if we can combine our forces and advocate together, it's possible to make big positive changes. And another priority the Patient Advisor Committee identified was, and again, which was also talked in the previous session, is awareness and public education. This is a great priority and need. We need to increase awareness. We need to make cancer a public conversation topic, and I think we are slowly but steadily moving towards that area. So these and other priorities identified by the Patient Advisor Committee help us to, identify the topics that can be presented in this conference. So once we have this data or information, we started to technically start the invitations and tech plan, etc., late last year, and today, you are experiencing this conference, which is really a pride and joy for us. So these are, you will see that this is the schedule. and we have around 22 speakers, mostly from Atlantic Canada, but we also have guest speakers from other places, for example, Northwest Territories, Quebec, and BC. We have special guest speaker, Daryl Fox, who is the younger brother of Terry Fox. You know, we Canadians have a very special connection to the Fox family, so we are very honored that Daryl Fox accepted to deliver the closing keynotes today. And we are going to, our speakers include patients, caregivers, researchers, healthcare providers, nurses, and advocates and leaders. So it's really a diverse set of speakers and a wonderful set of topics, again, which the Atlantic Cancer Consortium Patient Advisory Committee thought that the general public would benefit from. So thanks again for joining us. As of this morning, we had 265 registrants. Hopefully, this conference is something useful for all of us. So thank you again for joining us, folks, and every speaker. Thank you very much. So, I can also answer the question of why we organize this conference in other ways as well. Now, this is a public event. Our target is public. We want to engage with the public members. This is not a scientific or medical conference where, it's full with the technical stuff. No, we are here aiming to elevate and share patient and family stories, perspectives, experiences, and practical tips in terms of how to get support, how to get navigate the clinic, how to advocate for yourself, and how to prevent an early screen and so on. So this is a public conference where we are trying to, engage with the members of the general public. So thanks again for coming. Another point I want to make is that oftentimes the information that we are going to share during this conference is scattered in multiple places. For example, one place will tell you about the patient navigator, the other part will tell about precision medicine, other about the advocacy and so on. But here today, we try to bring all these different pieces together. So, this, I really think that this is at the heart of this conference and will benefit a lot of people. And I also think that the public conferences like this will increase the collaboration in the region, which we really need and we can do, and it will foster further discussions. With some of the speakers, for example, it was very easy to collaborate with. We initiated collaborations, and I'm really hoping that we can continue to collaborate in the future. So overall, folks, this conference is supposed to be an event of connection, sharing, learning, and empowerment. So there are other reasons that we really want to deliver such a public event because cancer is a very common disease. Around 2 in 5 Canadians are expected to be diagnosed with cancer. Sadly, in Atlantic Canada and Quebec, we have a little bit higher rate of cancer incidence compared to the rest of the Canadian provinces. So I think one question we have here is, how can we jump over this fence to the other side, where how can we reduce our cancer incidence? How can we go towards better days ahead? So there are a number of things which are already known. You probably also know, so I'm just going to go through this very briefly. To control cancer, folks, to prevent it, to early detect it, to treat it better, we really need to understand cancer. Many of us are frustrated that we still can't treat it well, and I hear you, but we also need to understand that we don't know everything about cancer. So that's why the research into cancer is extremely important. And we are lucky, as our patient panelists mentioned, that we have Atlantic Cancer Consortium, we have Atlantic Institute for Cancer Research, we have Beatrice Hunter Cancer Research Institute, and universities, laboratories, and so on in Atlantic Canada doing cancer research and making national and international collaborations. So research, as I'm a researcher, so I may be biased, but research into cancer will help us to understand cancer and can help us to control it better as well. I agree with our presenters that we need to, patient panelists, we need to prevent and early detect cancer. We seriously need to pay more attention to this, to preventing it and early detecting it by providing correct information, correct education. And we really need access to correct information, especially that we also have a problem of misinformation going on. So I call for information campaigns again. I advocate for it in every way I can. We really need it to inform the population and to minimize the effect of the misinformation. We need to help early detect, utilize cancer screening programs, make them available and accessible to folks. And because if cancer is detected early, the chances of successful treatment is really higher than the late stages. And we can improve access to effective treatment and clinical trials. As I think it was Marcela mentioned that, there are differences between provinces in terms of which drugs are covered and so on. So maybe clinical trials may or may not be accessible in every province. So we really need to increase access to those as well. And certainly the support to patients and family and community. And addressing their priorities, whether it's emotional, financial, physical, or medical. So these are some of the, obvious opportunities to help us control cancer better, decrease our risk. But there may be others. For example, again, we touched it slightly in the previous session, and some of the suggestions are mine, but some of them are actually by the patient advisory committee. Team care. We really need a team care in cancer care. It's not on the oncologists or radiation oncologists. We know that they are great. We are very grateful for them, but cancer support and treatment is not restricted to oncology only. There may be, again, psychosocial support. There may be physical like physiotherapy and so on. So we really need a team approach to cancer care so that the entire patient can be treated. Improving equity, really important. Every single patient I have talked to so far, they always wanted the best, better conditions for everyone out there, regardless of who they are, where they are, and so on. So this is really important, and it's great that there is a lot of emphasis on improving equity in terms of accessing service, information, and so on. But we also need to push for regional equity. Regional equity, Atlantic Canada deserves better. For example, better maybe access to clinical trials, which is sometimes the only treatment that a patient can get, folks. So this brings us to, regional collaborations by governments and more investment, and certainly they need to do that so that we can actually reduce the cancer incidences, improve the, well-being of the people. This is good for the governments as well because it reduces the cost and it improves the economy and society and so on, as Jill very nicely mentioned in the previous session. And certainly, we need to continue to work together with patients and communities. Kara and others also emphasizes in the previous session. It's really important to come together, but also integrate patients, families, and communities in every strategy, every research, every policy making that we are going to do regarding cancer, healthcare, cancer control, treatment, research, and so on. So please, let's continue to partner and integrate their voices into our activities. So in summary, why this conference, folks? We are all in this together, my sister, my mom, myself, you, the person next door. We are all affected by cancer one way or the other, right? Either we are diagnosed or our family friends, co-workers are diagnosed, but we are all affected by it. It's such a common disease. And patient and family voices are critical for us to actually guide what to do next, for example, in terms of services, in terms of research, in terms of policy making. So I'm really hoping that their voices will be continue to be integrated into the big initiatives and policies. There is a lot of knowledge and service to be benefited from. You are going to hear about that, for example, in the afternoon session. This could be precision medicine, it could be, psychosocial oncology or patient navigator systems, but many of us are not aware of it. So it's really important to increase awareness about those, and we are aiming to do that actually during this conference as well. Atlantic Canada deserves better cancer control. There's nothing wrong with us. And there's a lot that we can do. So we need to advocate for ourselves. And I believe that if we come together, like we are doing right now today with this conference, we will end up with better days ahead. So thank you, folks. In my last two slides, I just want to briefly talk about how wonderful it was to work with the patient advisors. I'm truly amazed by the patient advisor committee members who organize this conference, and they are helping to deliver this conference as well. Thank you, folks. It has been a very amazing and unique experience, and I hope that it's going to inspire many other folks, researchers or clinicians or governments or healthcare leaders. Even though we are a very young group, we organize this conference. We have created scholarly knowledge. I'm very excited to say that our manuscript is now accepted for publication. We are genuinely acting on advocacy. We are very motivated to do better for the next patient and family. And most importantly for me, for example, we are really learning about the patient and family perspective from Atlantic region. This is really precious. And I want to say that there is incredible patient power and potential in the region. So hopefully everybody is going to partner and work with the patients, families, and communities. So I really want to thank everyone who did teach us the patient and family side of cancer. And I want to say that we are inviting new members, especially from indigenous communities from Atlantic Canada. If you are affected by cancer, either as a family member or directly diagnosed with cancer, and if you are an indigenous person residing in Atlantic Canada, we would like to invite you to our committee. Please contact us ACCPAC at man.ca. And my final slide is thank you. Thank you to Patient Advisor Committee, all the current and past patient members, our coordinators, Georgia Scardassi and Erin Curtis. They have done an amazing job. And Dr. Angela Hyatt, who is a clinician in the group. We have a lot of other people to thank, especially the Atlantic Cancer Consortium leadership and our support and MSSU. They help us with recruitment and promotion. And of course, our founders and all the Marathon of Hope family. Thank you. With this, I'm going to stop talking. And right on time, do you have any questions or comments for me? I'll quickly look at the...
Yeah, there doesn't seem to be anything in the chat box right now, but there's a lot of great links being added, a lot of great conversation being had when it comes to this. And from all of us, all of the committee members, we want to say a very special thank you to you as well. You have been such a great leader and putting this all together and helping us get not only our story out, but yours as well. So a big thank you has to also go to you.
Well, thank you so much. I really appreciate that, Jack, coming from you. I think that really gives me the goosebumps.
All right, well, if there's no questions right now, we're going to take a short break because we've all talked about this morning, healthy habits, taking care of our mental health and making sure that we do the best that we can. So we will actually convene back for the next stage of the conference at 11:20. At 11:20, there's actually going to be concurrent sessions happening. One is going to be on precision and oncology, and that's going to be with Dr. Tony Romero, and he's from New Brunswick. We also have a concurrent session on liquid biopsies, which will be done in our other native language, which is French speaking. And that is going to be with Dr. Rodney Oquet, who is an MD and PhD out of New Brunswick. And that is going to be completely in French. So everyone take a good break, get some stretch, and we will see you all back here at 11:20. Thank you so much.